The U.S. Healthcare System by Amber McCormick, Professor Hughes, Introduction to Healthcare Class, January 22nd, 2015. Part 1, the U.S. Healthcare System. What is healthcare? In a general sense, healthcare is the process of helping ill people in order to make them healthy again, or if incurable, easing their pain until they pass away. The American healthcare system has become a conglomeration of companies and sciences working together to lengthen the life expectancies of people by finding cures and reliefs for ailments that were severely debilitating 100 or even 50 years ago. The preventative care now helps to prevent ailments and monitor patients' health before they before severe health problems take place. An example would be blood work determining high cholesterol and working to lower it before the heart attack occurs. Of course, all the advances in healthcare require quite a bit of money. This is why health insurance companies pay the bulk of healthcare costs for their customers, while the customers pay a premium each month. History. Healthcare used to consist of a doctor making house calls. The physician would be paid in trade by cash. However, the care was affordable for most people. A lot of the time, doctors went by superstitions or utilizing treatments such as bloodletting. However, with the organization of the first Marine Hospital, it seemed that healthcare was finally starting to head into a legitimately forward direction. In the 1900s, the American Medical Association band together to help determine the standards for healthcare that should be used. This organization also determines who should be able to practice medicine. With the developments fast growing, making healthcare more expensive, health insurance was considered necessary. Since the 1960s, the different types of health insurance have expanded widely. They range from more coverage for higher premiums to less coverage for more affordable premiums. With the passage of the Affordable Care Act, it is hoped that without uninsured people racking up debts that will not get paid, the cost of healthcare will go down, easing the burden on the nation's pocketbook. Important developments. As discussed previously, the beginning of the American Medical Association helped to organize in a forward healthcare in a forward direction. The AMA decides what standards should be maintained and what standards personnel need to abide by in order to practice medicine in the United States. The railroad industry was first to offer the medical programs for employees. While this was mostly death and dismemberment benefits, it helped the families of employees if the employee was killed or disabled while on the job. After 1910, the hospitals determined that cleanliness was key. Antiseptics were used to kill germs, and painkillers were introduced to relieve pain. In the 1920s, General Motors made a big deal with the Metropolitan Life to insure over 180,000 employees. This was a giant step forward in the industry of insurance, as it had taken a while to be taken seriously. In the 1930s, the government passed the Social Security Act. However, health insurance was not included. Even though insurance was not included, Social Security was a large step forward when it came to helping out the elderly and disabled. Important developments continued. Even though penicillin had been discovered 20 years prior, it was not used to fight infections until the 1940s. This medication is still used today and fights bacteria very well. In the 1950s, the government decided it was their responsibility to care for the sick and poor. This development has aided poor people for about 60 years. The poor have been able to care for themselves a lot better since being able to take advantage of government-provided health care. The 1950s proved to be a fruitful decade, and the more medical developments provided important vaccines. Polio has since been considered eradicated since the development of the vaccine, which is one development that Franklin Roosevelt would be proud of. Smallpox would also be nearly eradicated about 20 years later. In the 1970s, Lyndon B. Johnson implemented Medicare and Medicaid. The government would now provide medical insurance for those on Social Security. In the 90s, Human Genome Project began their quest to identify all the genes in a strand of DNA. This project would take years as there is over 100,000 genes in one strand of DNA. Understanding DNA is important to healthcare because it is believed that mutations in DNA are what make people susceptible to certain diseases or health issues. Stakeholders and their roles. Healthcare professionals are essential in the healthcare industry because they are the very ones that go through all the training in order to care for the patients. Without the care and knowledge of these professionals, there would be no healthcare field. Patients are also important to the healthcare industry because they are the very people the entire field exists to care for. The patients are looking for professionals that can lengthen their life expectancy, heal their sickness, and mend their broken bones. Along with healing, they are looking for someone to find cures to ailments that have yet to be cured. Schools are important to the healthcare industry because they are the ones that teach professionals how to care for the patients. Schools apply the new research and new knowledge to their curriculums, teaching the healthcare professionals new and improved practices. Insurance agencies are important because they provide most of the funds to pay for healthcare. Of course, most of the patients pay premiums for the insurance, but the insurance agencies pay the bulk of the funds, even negotiate for lower prices for services in order to pass the savings to patients. Politicians can help or hinder the healthcare field. This is because some politicians may make promises of reform or some sort of advocacy for healthcare only to fail in delivering those promises. However, some can advocate for better healthcare and actually make it happen. A good example of this is the Affordable Care Act. Part 2, the cost of healthcare. How costs are set. Reimbursement models. First, the fee-for-service method is the oldest method, where the healthcare providers are paid for each service they perform. This means the more healthcare services they perform, the more they get paid. However, some insurance companies negotiate a discounted fee-for-service rate rather than paying the hospital's set rate. Capitation is a model where the insurance has a contract with the provider giving a predetermined monthly rate. This rate lasts for 1 year, and it does not matter how many services the provider performs for the patient with the capitated rate, the provider still gets the same amount each month. Managed care organizations are insurance organizations that enter into contracts with healthcare facilities and professionals to the insured for a negotiated rate per patient. MCOs also offer incentives to the facilities that provide lower cost care. How costs are set continued. Medicare is a federal program where the government determines eligibility. This eligibility is usually when a person turns 65 and when people are determined by the Social Security Administration to be disabled or unable to work. Medicare has four parts. Part A covers hospitals, nursing homes, and hospice. Part B covers doctor services and outpatient care. Part C is a mixture of both parts A and B, only a larger choice of healthcare professionals. Part D takes care of prescription drugs. Medicaid Medicaid is a government-supplied health care coverage for the poor and medically needy. Medicaid is for individuals that are poor, under 65, and ineligible for Medicare. The medically needy term means people make too much money to be on Medicaid but have unpaid medical bills that reduce their income. This can include pregnant women, children, and disabled people who are under 65. Medicaid is paid on a fee-for-service discount. The state pays for each service performed but at a set rate. The state does not pay the hospital rate. The hospital receives the state's rate. CHIP is a program for medical coverage program for the children aged 19 and under who are ineligible for Medicaid yet cannot afford private insurance. The program is similar to Medicaid, but as it is partially funded by the federal government and provided by the state government. How technology affects costs. Electronic health records were innovated in an effort to reducing preventable medical errors. It was persistent that people would misread information in charts or not record or even missing from patient paperwork. The technology was adapted to keep patient charts, including medical history, diagnosis, medications, immunizations, allergies, lab results, and x ray images, all on a computer. So they may be accessed from any computer that has access to the database. While the equipment and the computer programs may have been costly in order to implement the use of EHRs, the forecast is that this technology should save the healthcare system in billions of dollars. It is also forecasted that the use of EHRs will reduce drug expenses, limit the, the duplicate ordering of tests, and decrease billing errors. This requirement This requirement is also intended to make records of all people available to the doctors to help reduce fraud and improve healthcare because any doctor anywhere can access a patient record and will not have to repeat testing that has already been done. One of the reasons why other countries are envious of our healthcare is because of how far advanced we are. The development of new medical practices, new medications, and new equipment costs a lot of money. In 2007, spending on biomedical research funding was $101 billion. This research has public and private funding. One of the top foundations giving to the healthcare industry was the Bill and Melinda Gates Foundation, giving $1.71 billion. Our country is the largest producer of medical technology as well as largest consumer of the same technology. The technology is expensive to develop, so it is expensive to utilize as well. However, these technologies have been greatly responsible for lengthening the lifespan of Americans. An example of improvement on technology is the AED, or Automated External Defibrillator. This piece of technology can be found in most public places, brightly colored in a clear box. This equipment is used for people who suffer from sudden symptoms that are apparent as a heart attack. If someone collapses to the ground, an AED can be attached to the person's chest, and the computer in the AED will find a heartbeat if there is one. The computer will tell the person administering the AED if there is or is not a heartbeat in the case of cardiac arrest, and if no heartbeat or an irregular heartbeat is discovered, the computer would ask the administering person to call an all clear and hit the big button. This will apply an electric shock to the patient trying to restart the heart. This is something that most people have probably seen in a movie or on television. However, with the advent of new technology, it is something that the average Joe on the street would be able to do in an emergency and save someone's life. How technology affects costs continued. Delivery of quality care. If the quality of the care provided was not very good, there would be no way patients or insurance companies would continue to pay for it. Therefore, healthcare organizations must innovate new ideas and offer excellent care to patients. Personalized medicine was made possible with the Human Genome Project. Using patients' genetics, healthcare professionals can look for mutations in DNA or look for markers in the DNA that indicate a certain propensity for specific diseases. A new technology has started sweeping the nation is using health apps on smartphones. These apps can help provide easy access tools for people to manage their health and improve it as well. This There are wearable devices that monitor heart rate, blood pressure, and even blood sugars. In an ever-increasing busy country, these services are going to be more popular, so patients can manage their health on the go. The FDA has okayed at least 75 health apps by 2013. That number is only going to rise as more people engage in smartphone use. E-prescribing. To lower the risk of prescription errors and fraudulent prescriptions, a large number of health professionals have turned to e-prescribing. This technology is used for physicians to send pharmacies the prescriptions electronically. The pharmacists do not have to read the